all, thank you to all my friends in Techno India University for giving me this opportunity to share a few thoughts and words with you this afternoon. Friends, without a shadow of doubt, for a country to come out of the shadows of a traumatic independence, it spent 7 decades to get back to some kind of quality of life and living. And on the 73rd juncture of 73rd and 74th year of its existence, something like COVID has been a very cruel blow. There is no way that we can mince our words and sort of, understate the problem. It's entirely a different matter to say that could the problem have been less? Was this sort of infection toll of nearly 8 million people, 125,000 dead, was it inevitable? Perhaps it was not. The wisdom and the self-discipline, the cleverness that was shown by the countries of Southeast Asia, the Korea, Japan, Vietnam, Laos, Cambodia, even Sri Lanka, seemed to have been lost on the South Asian neighbors, on the European countries, and of course on the United States. We succumbed to the infection and we have paid a heavy price for it, not only in terms of the disease burden, but also in terms of the crippling impact on the Indian economy, crippling impact on inflation, on job losses, and every other possible toxicity. But friends, India has seen worse. If we consider the 8 million people who've been inflicted with the sickness, if we consider the 125,000 lives lost to be the ultimate disaster on this nation, just look back. In 1946 to 1947, 10 times the number had their lives disrupted. About 15 times the number of lives were lost in the process that we euphemistically call the partition of India, the independence of India. So we have seen worse, and we have had the perseverance and resilience to emerge from that. But question remains that is it just a function of inspiration? Is it just a function of emotion? I don't think it is. So speaking to you as a doctor, speaking to you as somebody who is incorrigibly addicted to each and every detail of healthcare, it just cannot be an emotive, a spontaneous, a knee-jerk kind of exercise. I'm sure we will, but the process of bouncing back will be based on 2 fundamental premises. The first premise will be the premise of intention. The intention has got to come from the policymakers, the lawmakers, the politicians, the ministers, the administrators, the bureaucrats. And if we are to show to our 135 crore people, 1.5 billion people, that we are seriously intent on refabricating, on reviving the social and the healthcare fabric of this country, then it has to be backed by serious policy. And the policy has to supply enough resources. Because to have a kind of flood of emotions, a flood of parables, a dictionary of wisdom, but at the end of the day, we end up spending 1,500 rupees every year for the healthcare of an average Indian. 1,500 rupees, which can't even buy you a decent meal for 2 people in any very poor quality restaurant, is all we afford to spend on healthcare of our citizens. So it has to be a clear-cut policy. Why is policy important? Because a lot of the good intentions of Indian healthcare gets drifted, gets eroded in the confusion between what is public, what is private. What is controlled by the central government? What is controlled by the state government? And it is like a block of wood falling between two stools that Indian healthcare has so many factional stakeholders that at the end of the day it leaves you wondering that is it suffering from the syndrome of being nobody's child? So we need clarity. We need clarity to tell us that which aspects of healthcare is in the domain of the central government and which aspects will be controlled by the state and who funds what. We are not going to have an Aladdin's lamp which is continuously going to produce something out of nothing, because at the end of the day, our aim is to have decent, quality healthcare which does not put people into crippling indebtedness. Private healthcare today accounts for almost 60% of the total turnover, of the total number of procedures done, patients seen. Government healthcare also contributes a lot, which is the rest 40%. But there has to be effective communication, there has to be effective interaction between the two. It is this partition, it is this kind of, a barbed wire that is separating the public from the private in Indian healthcare today. Perhaps the only more rigid boundary that we know in India is probably the India-Pakistan border. So we have to circumvent these differences. Bridges will have to be built. And there is tremendous policy confusion, which is preventing Indian healthcare from growing to its own potential. And the other area, where today speaking to you people, to the young minds of Techno India University, but where in healthcare we are being tremendously disingenuous, is not inspiring the youngsters to join the army of people who is necessary to man Indian healthcare. It's not just doctors. It means doctors, it means nurses, it means technicians, it means microbiologists, it means biostatisticians, it means healthcare managers. So we have to inspire these people. It is out of their volition, out of their conscious thinking. As somebody just said, what wonderful lines, follow your passion. So the youngsters of today, who are not burdened by the wisdom and negativity of the old folks like myself, who will have to be inspired to pursue the dream of coming into healthcare and serving this country of 1.5 billion people. We are not doing a great job of that in medical education today. The basic medical education like MBBS is almost reads like a filthy piece of paper. It has no relevance in our lives. It is considered to be a poor man's degree. We have this entire, sort of burden of young students repeatedly sitting for multiple choice questions. Somebody who wants to be a gynecologist ends up being a pathologist. Somebody who wants to be a surgeon ends up being probably, a kind of pathologist or anatomist. Have you ever heard of a civil engineer being forced to become an electrical engineer? There isn't. But in medicine, we are failing to inspire people and lead them to their path where they can pursue a vocation of their choice. When we take in medical students, 50% of that intake of medical students are women, young women. India produces about 80,000 doctors per year. At the intake level, about 40,000 or more are young ladies, young girls. But the time they have finished their medical education and they have come into medical practice, about half of them have left the profession. There is less than 25% of women left in medicine today when it comes to effective clinical practice. We have to look inside and ask ourselves a question. that why are we such a cruel and misogynist kind of profession? Why can we not look at the difficulties of the female, of the women who had chosen in the very beginning to pursue this specialties? So if Indian healthcare has got to get back to its feet, which we are sure it will, again, it will not happen just based on the foam and froth and the bag full of sentiments that comes out from nowhere. We need policy, we need resources, and we need the realistic inspiration that is going to inspire the youth of India, India's most valuable commodity, the young minds, the young brains, the youth of India has got to come and populate the aridity of Indian healthcare today. I'm sure we will bounce back. Because as it is said very often, that China is a country that prospered because of the government, and Indians, more often than not, prosper in spite of the government. I hope it has been said in jest, and it will remain in jest, but honestly, in healthcare, there are that many obstacles and there are that many stumbles in the way that it almost sounds as being realistic. We will bounce back. The lessons that pandemic has taught us will remain ingrained. A lot of the things in clinical medical management has changed. Our outlook on public health, on pharmacology, on critical care management has undergone a radical revolution in the course of the last 7 months. And this lesson will be embedded in the DNA of every doctor's for centuries to come. But once again, let the healthcare of this country, which will and certainly be equal to the challenge, be based on intentions, reality, and resources. And if I can twist around the words of Tagore a little bit and end by saying that, Father, into that new dawn, into that new reality where inspiration mixes with serious intention, let my country awake. Thank you very much. I remain in your debt. Thank you.